This is a 2-year-old dog who has difficulty breathing due to tracheal collapse. Today, we are going to place a tracheal stent in order to help this dog achieve a better quality of life at home. This video is of the dog prior to the start of procedure. Note the breathing pattern. This breathing pattern and the noise that accompanies it is very common in dogs with tracheal collapse, and is a result of the trachea being so narrow that this dog cannot get air from his mouth into his lungs. The resulting lack of oxygen causes this dog to be very uncomfortable, interfering with his ability to play, eat normally, and even sleep. Placing a tracheal stent will help. The first step is to perform tracheoscopy with a video endoscope to evaluate the trachea and locate the sign of collapse. As you will see, the trachea appears open and then begins to narrow as we pan back from the lungs toward the mouth. This is the area of collapse and the reason that this dog is having difficulty breathing. Once the area of collapse is identified, a stent is measured and placed into the trachea using fluoroscopy, which is a video X-ray. The stent is made of a specialized material that is mesh, flexible, and is able to expand to hold the trachea open and allow the patient to breathe normally. The stent is initially held in place simply by its expansion into the trachea, but over several weeks, the tracheal tissue will grow through the mesh and hold the stent in place permanently. This is video of the same dog following tracheal stent placement. You can see that the trachea is now held open by the stent mesh. Following the procedure, we take X-rays to evaluate the positioning of the stent and to allow us to follow the stent placement in the future. Here is the same dog about 10 minutes after recovering from anesthesia. You will find that his breathing is much different. Okay, this is about 15 minutes post-op. Hi, Tiger. Hey, buddy. Look at that.
I don't like your friend.
Look at that. And here he is, about 30 minutes later, out for his first walk in a long time without feeling like he couldn't breathe. This patient recovered normally and was able to be discharged a few hours after his procedure. He went home and slept and ate normally for the first time in months. Tracheal collapse is a serious medical condition that affects many dogs and causes them to have a poor quality of life at home. Tracheal stenting is a minimally invasive solution that offers immediate results with minimal discomfort to the patient. It's not for everyone, and potential complications include stent dislodgement and stent fracture. Some patients will require 2 stents if the collapsed area of their trachea is too long for 1 stent to hold open. Most patients will show immediate improvement following this procedure, 75 to 80% not requiring any further medical treatment to control their breathing signs. There is follow-up, and it's recommended that these patients be seen every 3 months for evaluation and chest X-rays to make sure that they continue to do well at home and that the stent has not moved. The immediate improvement in the patient's ability to breathe and relatively low risk of complications makes tracheal stenting an exciting new treatment option to help us improve the quality of life for patients suffering from tracheal collapse.
Pepper, I can't even hear you breathing. Good boy.
You good boy?